So that was the paradigm shift, and that was a video by Paige. Now we're going to talk about another video, and this video really gets us kind of the best understanding of what the PFCC is all about.
My name is Lisa Brazier. I have been a nurse for 30 years. I work with AirMed, the University of Utah, and I've been here for about 8 years.
Hi, I'm Melody Hadfield, and my little 3-year-old was recently in an accident. So I came outside and I saw my little 3-year-old on the pavement, and I wasn't sure if she was alive or not. And seeing my little girl on the road, so broken.
When we landed, we get out of the helicopter and we see that the EMS was there, and they're all kneeling down in the middle of the street, and this little girl on a backboard, and the first impression that you get was, this girl is really serious.
I was just kneeling over Leia, trying to be as helpful as I can, but I remember taking note that if I wanted to be near my little girl, I needed to be very careful with my emotions and try to be as helpful as possible.
The first thing I noticed was I saw somebody down by her legs, and it was a lady who was holding her legs, and I remember looking at her, and I said, "Are you Mom?" And she said, "Yes." And I said, "We're going to do everything we can to save your little girl's life." And so we put her into the ambulance because I didn't want to do everything right there in the middle of the street with everybody looking. And we had to put an airway in her and get things going. I knew that she had a severe head injury.
Her presence was so calming, and she took very good control of the situation, and I knew immediately that Leia was in really good hands.
As we were getting her ready to go on a flight, I looked at the mom, because she was still there in the ambulance with me, and she'd been in the corner really calm, but I was thinking to myself, I didn't want this to be the last vision that she had of her daughter. There, you know, in the ambulance, not moving, and not knowing if she was going to live or die. And so I asked Mom, I said, "Do you want to come with us?" And she's like, "Yes, can I?" And so I asked my pilot and got permission, and he said it was fine. So we brought her with us, and I just felt like it was the right thing to do.
She just knew that I needed to be with Leia, and Leia needed me. I know Leia was unconscious, but I'm her mom. I have a connection with her. So whether she's conscious or not, I feel like I can connect with her and help her to fight for her life. So I remember them driving us up to the airplane, or to the helicopter, and me following as closely as I could to make sure I wasn't left. But they were so kind, and I knew that they would not they would not let Leia leave without me. And it was so smooth how it all ran. I was amazed. We got Leia in. I believe it was the pilot. He opened the door for me, and I knew exactly where to sit. I had to pick up, a few things had to be picked up. So happy to do it. I didn't care if I had to just squeeze in with things piled up on me. I did not care at all.
There were a lot of things that we did en route that we had to work on. We were bagging her and giving her some more medication, and we have a really tight space here in the helicopter, and there's not a lot of room, and so I was just handing all the equipment to the mom, and I'm like, hold this, hold this, hold this, and she was just really good about it, but she could see that we were doing all that we could to keep her daughter alive. And I just felt like that was really important, because I didn't know what the outcome was going to be. I knew she was really serious, and I didn't feel at the time that she would be able to make it, and I wanted the mom to know that we did the best we could.
Watching them care for her and take care of her and perform the procedures that they did was actually really comforting to me, because I knew why they were there. They had a mission, and it was to save my little girl, and they did a lot to her. And watching the breathing tube go down and all of those procedures did not bother me. I'm a parent. I want my girl saved, my child saved. So I was grateful for what they were doing. There was nothing that they could do to her that would have been any more devastating than to see her so helpless on the road. If she did pass away, I think it would have been a huge comfort to see that they were working really hard and trying their best to save her life.
So we get her to the hospital, and of course she wasn't there in the trauma room as they were assessing her, but as we were taking her to the CT scan and we were moving out in the hallway, the mom gives me a big hug and she said, "Thank you so much for letting me come."
I feel that it would be extremely devastating to have to stay on the ground while Leia took off. Gratefully, my little Leia survived and is doing well. But I think if she would have passed away on the way to the hospital, my grieving process would be much more painful and harder if I had not been with her. If I had any say at all, I would want to be with my little girl.